Welcome to your second online lecture, which will begin with Chapter 13, Inventory Management. Here's the general outline for Chapter 13. We are all probably familiar with what an inventory is. It is a listing of the items used by a business in everyday operations. A lot of the managing of inventory is delegated to technicians. What is the goal when managing one's inventory? You're pretty much trying to optimize. You want to ensure that drugs that are likely to be needed are on hand and ready to use. This means items are not expired, damaged, or in any way unfit for use. The book refers to the technician that is responsible for managing inventory, a purchasing or inventory technician. Another term used in the text is pharmaceutical buyer. This is what we call the technician at JCMC that is responsible for inventory. There are many different entities that are involved with the inventory process. There's the pharmacy, the wholesaler, manufacturers, the governments involved, insurers, and other third parties. The pharmacy typically buys drugs from wholesalers, but can buy directly from manufacturers. The majority of manufacturers sell directly to wholesalers, which resell inventory to hospitals, pharmacies, and other dispensers. There are thousands of manufacturers, so you can imagine how difficult it would be to deal directly with the manufacturer of a particular item. This is where wholesalers come into play, which are government licensed and regulated. Wholesalers stock thousands of items, which provides pharmacies with one-stop shopping for most medication needs. Using wholesalers simplifies the purchasing process, which saves time, reduces effort, and money. A formulary is a list of medications that are approved for use in a particular system. The system may be a hospital or insurance plan. The text mentions two types of formularies. An open formulary allows the purchase of any medication that is prescribed. This is a very costly formulary. A closed formulary contains a limited list of medications, which greatly reduces cost. In a closed system, physicians may need to obtain permission to prescribe certain medications. For example, at JCMC, we restrict certain antibiotics such as Zyvox and daptomycin to infectious disease. This is due to cost, misuse, and monitoring parameters for the drugs. In addition, some medications may have automatic substitutions to other medications, referred to as therapeutic equivalents. As mentioned before, the DEA regulates controlled substances. The DEA sets requirements on distribution, storage, record keeping, and ordering of controlled substances. The DEA also requires that a complete inventory of all controlled substances be taken every 2 years. A perpetual inventory is required for Schedule II substances. The text reminds us that it is of utmost importance to deal with reputable wholesalers and suppliers. Some manufacturers produce counterfeit medications that look like actual medications, but contain minimal active ingredient. These counterfeit medications are then sold to unfamiliar wholesalers. Inventory systems provide a means to keep count of what's on hand, predicts future needs, and reorders items to optimize inventory. You don't want to have too many medications on the shelf because this could produce spoilage, and if you don't have enough medication, then a drug may not be available when it is needed. Remember, we are trying to optimize inventory. Order entry devices are used to enter ordering data. This seems to be rather old school. When you visually inspect that a drug is near a minimum level, the drug's ID number is entered by hand or scanned into the device using a barcode. A desired quantity is entered to complete the order. We have a huge carousel in our pharmacy and reorder points are entered. The reorder points are maximum and minimum inventory levels for each drug in the carousel. The purchase order is automatically created when the inventory reaches a certain minimum on-hand level. The computer system will reorder the correct amount of drug based on a predetermined level that has been entered into the system. Whenever I hear turnover rate, I think of employees and how long it takes for one to leave a certain job. In terms of inventory, it refers to the number of days it takes to use the complete stock of an item. I'm not too familiar with the jargon of 30 days net or 210 net 30, but the idea is that if a supplier does not get paid until day 30 after an order has been made, then if you completely run out of stock before the 30 days, then you in effect made money off the order and lowered your costs. Spoilage occurs when a medication is sitting on the shelf and can no longer be used. The two major factors in this are time and storage conditions. A drug has to be used before its expiration date, or it may not be as potent. In addition, certain storage requirements must be followed, or the integrity of the medication can be compromised. Never dispense an expired medication or a medication that will expire before being used, which has become a greater issue since patients get 90-day prescriptions filled now. Here's an example of an automated dispensing system. This type of contraption consists of cells that hold each medication. Once a drug is ordered, the machine counts the correct number of pills and dispenses them into a prescription vial. The hospital uses Omnicells, formerly known as Pyxis machines, to dispense medications on the floor directly to the nurses. Nurses are able to search for medications based on patients' profiles, and each drug is tracked and charged to the patient. We have already alluded to automatic order systems, where the system will order medications whenever the quantity reaches the reorder point. Once the order can be filled, a message will confirm the order. Buyers have to keep in mind that each supplier has its own set of guidelines that have to be followed in order to receive credit for returned items. Companies have been established that actually specialize in returns of expired drugs to manufacturers. Once a patient takes their prescription bottle, the bottle cannot be returned to the pharmacy stock even if the bottle is unopened. Let's continue with Chapter 14, Financial Issues. Here's the outline for Chapter 14. What are third parties? Third-party programs are another party other than the patient or the pharmacy that pays for a portion or all the cost of medication. In other words, an insurer. Pharmacy benefit managers are companies that provide drug benefit programs. Examples include Cigna Healthcare and Express Scripts. Online adjudication is the confirmation of prescription coverage via communication between the pharmacy computer and the third-party computer. Co-insurance is the agreement between the insurer and the patient to share costs. Copay refers to the price the patient pays for the prescription. Keep in mind that the copay is determined by some agreement between the insurer and the pharmacy. The term dual copay refers to copays that apply to generics and copays that apply to brand names. A deductible is the amount of money that has to be paid out of pocket by the patient in order for the patient to receive benefits. Maximum allowable cost is a term I was not familiar with, but this is the max price per tablet an insurer will pay for a given product. Usual and customary refers to the price that an insurer will pay for a prescription that is deemed reasonable. Sometimes this is called the usual, customary, and reasonable price. Before patients can get their prescriptions filled at a pharmacy, the pharmacy has to enter into a contract with a pharmacy benefit manager. Next, we'll talk about some third-party programs. The text points out that private health insurance may pay for prescribed expenses like prescriptions when the patient is covered by a medical policy or when the patient's coverage includes prescription benefits. Individuals have access to private insurance through employment or private insurance companies. Once the patient has coverage, they are given a prescription benefit card, which has all the information needed to bill the third party so the prescriptions are covered. Managed care programs provide medical services, including prescription coverage, in return for a monthly premium and copay. HMOs, or health maintenance organizations, consist of a network of providers employed by the HMO or who have entered into a contract to follow the HMO's policies. If a patient was to seek services outside of the HMO's network, expenses will not be covered. PPOs, or Preferred Provider Organization, consist of providers contracted by the insurer. This option may provide more flexibility, but it may come at the price of higher premiums. Another distinction is that PPOs do not require a primary care physician within their network to make referrals. Point-of-service programs again consist of providers contracted by the insurer. The patient chooses a primary care physician, and the primary care physician has to write a referral for the patient to seek care outside of the network. The largest public health insurance plans in the U.S. are Medicare and Medicaid. Medicare is a federal program covering patients 65 years of age and older. In addition, it covers disabled people under age 65 and people with kidney failure. What is the difference between Medicare Part A and Medicare Part B? Part A covers inpatient hospital expenses, and it may cover some hospice expenses. Part B covers doctor's services and some things that Part A does not cover. Part D is the Medicare prescription drug plan. This is an optional component of Medicare. The plan consists of a premium, deductible, and copay. Medicaid is funded at both the federal and state levels. The intent is to provide coverage for eligible individuals and families with low incomes. Each state determines the prescription drug formularies for Medicaid. If a drug is not listed on formulary, it may require prior authorization from the physician who prescribed the drug. However, just because a prior authorization was submitted, it doesn't mean the drug will be covered. If you are accidentally injured on the job, you could qualify for workers' compensation. Patient assistance programs are offered by drug manufacturers to help low-income patients who require medications they cannot afford and do not have insurance coverage. Here's a recap of the online adjudication process. This is pretty much the way people find out exactly how much they will need to pay for their prescription. A dispense as written indicator is used when a brand name drug is dispensed and a generic drug is available. Here's a list of the indicators and what they mean. They're listed for your viewing. Unfortunately, online adjudication is not a seamless process. Here are some common reasons for rejections. NDC not covered, which is possible if the drug is non-formulary. Refill too soon, which happens all the time with controlled substances. Invalid personal code occurs when the individual covered is coded as someone else. For example, the spouse is coded as the cardholder. There may be invalid information like birthday, gender, or prescriber. The computers may be down, which means communication cannot take place between the pharmacy and the insurer. Sometimes coverage is terminated, which happens when patients lose their employment or change jobs and they haven't brought their new insurance card into the pharmacy. I could not imagine a world before online claim submission, but it did exist. Processing paper claims involved the pharmacy and the patient completing a form that was issued by the insurer. A universal claim form was a form that was accepted by many insurers. A CMS 1500 form is used by healthcare providers to bill for disease state management services. Illnesses most often covered by disease state management include diabetes, hypertension, asthma, smoking cessation, and cholesterol management. In-house billing occurs when a patient's finances are taken care of by another individual, such as a legal representative or another family member who does not live with the patient. A monthly bill will be mailed to the representative and he or she will pay the pharmacy. We have talked about medication therapy management briefly before. This is a service provided to all patients, but specifically for reimbursement issues, it is the service provided to Medicare Part D participants who are taking multiple medications or have certain diseases. The CMS 1500 form is used for billing MTM services through prescription drug plans. The National Provider Identifier is a code that is assigned to recognize healthcare providers, in this case, to help recognize providers of MTM services for billing purposes. In order to bill prescription drug plans for MTM services, the pharmacist or pharmacy must be enrolled as a provider for the patient's prescription drug plan and have an NPI number. We have gone over the first few bullets here. We'll talk about CPT codes or current procedural terminology codes, which provide a systematic way for pharmacies to bill for MTM services. CPT code 99605 is used for first-time interventions. Code 99606 is for follow-up sessions. 99607 is an add-on code used with 99605 or 99606 when additional 15-minute increments of time are spent face-to-face with the patient. Let's continue with Chapter 15, Community Pharmacy. Here's the outline for Chapter 15. The setting that dispenses the most prescription drugs and employs the most pharmacists and technicians is community or retail pharmacy. Retail pharmacy is the practice of providing prescription services directly to the public. Due to the demands on counseling and education, more responsibility to dispense has been placed on the technician. There are several types of pharmacies. One such type is independent pharmacies. These are owned by one individual or a group of individuals. Most compounding occurs in independent pharmacies. A franchise pharmacy is a pharmacy that is a member of a small chain of community pharmacies that are independently owned. We are all familiar with chain pharmacies like CVS, Rite Aid, and Walgreens. The decisions are, as far as pharmacy practices are concerned, are made at the corporate level. Pharmacies located in stores like Costco, in this area we're probably more familiar with Sam's Club, Kmart, or Target are called mass merchandiser pharmacies because The store they are located in sells mass merchandise. Another type of community pharmacy is the food store pharmacies like Kroger's and Food City. Just to recap, technicians in a community setting will be responsible for filling, labeling, and recording prescriptions, operating the cash register, stocking and completing inventory, maintaining patient records, and preparing insurance claims. Here's another slide talking about HIPAA, and at this point I feel like everyone has a good understanding of this act. Here are examples of patient identifiers to keep in mind when trying to uphold HIPAA regulations. Some tips to keep in mind when dealing with patient information. Never discuss patients outside the pharmacy. Shred important documents. Speak to patients and other healthcare providers in a private area. Never give information about the patient to another individual unless the patient has provided written authorization to do so. The work area of pharmacies generally contain the same elements. Some state regulations determine the space and equipment used in a pharmacy. Common areas include the following list of items: a prescription counter, which is where non-compounded items will be prepared. Transaction window refers to where the patient drops off and picks up prescriptions. In some pharmacies, these are two different areas. Storage is a sink, computer system, prescription bins or shelves, and compounding area. Customer service seems to be a lost art at this point. Luckily, I'd rather deal with the public in the hospital. The text points out that good customer service involves presenting yourself in a calm, courteous, and professional manner. This is a lot easier said than done. I believe to provide good customer service, one just has to think about how they would want to be treated as a patient going to have a prescription filled themselves. In a world where we are quick to judge or profile individuals, it is easy for us to forget that a patient just came from a physician and may now have just been informed of a disease that has to be treated. Patients are very emotional, and the last thing they want to do is sit and wait for a prescription to be filled. Always listen to the patient and don't jump to conclusions. Maintain good eye contact and repeat back to the customer the request if it is unclear. Never use negative language. Respectfully use the patient's name. Do not use pet names like Sweetie, Honey Doll, Sugar Baby. When it comes to phone calls, some pharmacies have a protocol that is followed to introduce yourself. Whether or not these standard steps are in place, be sure to identify the pharmacy and yourself. Be more cognizant of the way you come across when you talk. Body language is not interpreted over the phone, and most of what you say is taken literal. Any phone call that needs a pharmacist should be directed to a pharmacist for liability issues. The more I read about the characteristics of good customer service, the more I realize that if a person takes ownership and realizes his or her actions are a reflection of him or herself, the better he or she is going to be at customer service. No customer will respect an individual that doesn't dress or groom themselves properly or use courteous language. Always be aware of patients that may need assistance. If you see someone who needs help, ask them if you can help. Many patients have so much pride that they will not ask for any assistance. This highlights the idea of patients being sick, and the last place they have to go before going to the comforts of their own home is the pharmacy. As technicians, you'll never provide medical advice, and any inquiries should be directed to a pharmacist. The last few chapters come back to items we have already covered, so we'll do a brief review of these items for completeness' sake. Step 1 of the filling process is receiving the prescription and quickly reviewing it. Make sure key information is provided and it is legible. We talked earlier this semester about how pharmacists check for the validity of the prescription. In this case, the validity is referring to, are the items present on the prescription that need to be present in order for the prescription to be filled? Keep in mind the prescriber's signature is required for a prescription to be considered valid. Here's the key information you're looking for on the prescription. This information will be entered into the computer system if it has not already been provided. Step 2 was entering the prescription information into the computer. Remember, the goal is to get the correct medication to the correct patient. Step 3 is generating a label. Once a label is produced, cross-check it with the prescription to make sure there were no transcribing errors. Any typing errors? Is it the correct patient? Step 4 is retrieving the medication. Keep in mind the sound-alike, look-alike medications. Some medications have similar shape and color, and even worse is that manufacturer bottles look similar for different drugs or for different strengths of the same drug. One of the worst mistakes that can happen is accidental substitution of one drug for another. Now pharmacies contain a computer-based pill identification program that gives the pharmacist on the final check a way to compare the pill in the prescription bottle to a picture of the medication that should be dispensed. It's always good practice to have someone double check any math calculations, especially the ones you're unfamiliar with performing. Try to avoid using more than one container or preparing more than one product at a time. Most interruptions are unavoidable, but with the right workflow you can limit distractions and interruptions. All equipment must be maintained, meaning it is cleaned and calibrated on a regular basis. When residue from tablets is not cleaned properly, you run into the potential of exposing patients to medications they are allergic to. If measuring equipment is not calibrated, you can overdose or underdose patients. I don't necessarily want to say all prescriptions, whether in a vial or a bottle, must be dispensed with a child-resistant cap, but it's pretty close to all. Patients can request an easy open lid, which may be more appropriate for patients with arthritis who are physically unable to open the bottles. When pouring liquids into a bottle that is prepared for the patient, be sure to select an appropriate size bottle. Bottles come in 2, 4, 8, 12, and 16 ounces. Sometimes you'll have to prepare creams and ointments that are not pre-packaged. In this case, you have to transfer the cream using a spatula into the correct container size. After the prescription label is placed on the container, then any auxiliary labels are placed as well, which provide the patient with quick information about the handling or administration of the medication. The last step is carried out by the pharmacist, and that is to review and approve the prescription. The pharmacist is to verify the quality and integrity of the end product. Is the correct drug going to the correct patient? When we talk about the integrity of a medication, we are referring to its stability and potency. If medications are not stored properly, for example, exposed to light, humidity, or certain temperatures, the medication can begin to break down and become less effective. One difference between community pharmacies and hospital pharmacies is the verification step. In a community pharmacy, the verification step is carried out by the pharmacist only. In the hospital setting, the nurse serves as the second and final verification step before the drug is dispensed to the patient. When a customer comes to pick up their prescription, follow HIPAA's regulations. Although it may be tempting, never ask a patient if they would like to also pick up another family member's prescription that has been filled, because this is a violation of HIPAA. The customer signs a log to record that the prescription was actually picked up. Third-party payers will review the signature log when auditing pharmacies. For Schedule II medications, pharmacies may require a driver's license be provided before picking up the medication. Although technicians are going to be expected to know where OTC medications and other products are, any recommendations must be left up to the pharmacist. Some medications can exacerbate existing health conditions. One example is Benadryl in male patients with benign prostate hypertrophy. If patients with BPH take Benadryl, the Benadryl may prevent the bladder from contracting, and the patient may be unable to urinate for days. In addition to filling and dispensing medications, technicians are expected to order stock, receive and unpack orders, inspect for any damage and expiration dates of products, and maintain the pharmacy in good working condition. OTC products contain shelf stickers that can be used for inventory identification. They also contain unit price information, which is the price of a unit of a medication, rather than the price of the entire package. We are all familiar with the markup price, which is the difference between the retailer's purchase price and the actual sales price. Let's finish up with Chapter 16, Institutional Pharmacy. Here is the outline for Chapter 16. In the hospital, the pharmacy prepares or orders unit dose drugs. The drug is packaged in a container containing the exact dose of the medication. If an ordered medication comes in a regular stock bottle, the pharmacy has the equipment to package the item in a unit dose. A lot of medications are actually stocked on the floor near the nurse's station, so the nurse can easily obtain the medication. Hospital pharmacies are also responsible for preparing intravenous medications as well as TPNs, or total parenteral nutrition products. The pharmacy director has overall responsibility for the pharmacy services. Depending on the size of the hospital, additional managers may work under the director. Johnson City Medical Center has a director of pharmacy, a pharmacy operations manager, a clinical coordinator, and an IV room supervisor. Patient rooms are divided into groups based on similar health conditions, and they are referred to as nursing units or patient care units. The workstation for the personnel in a particular nursing unit is called the nurse's station. Staff that you may run into in a hospital setting include, but are not limited to, physician's assistants, respiratory therapists, patient care technicians, which are personnel that assist nurses in patient care activities, and social worker. There are also nurse practitioners, registered nurses, licensed practical nurse who provides basic care under the supervision of an RN. LPNs can administer medication to patients, but this is limited as well. Some more terms to familiarize yourself with. The inpatient pharmacy is the pharmacy that provides services only to patients in the hospital. Satellite pharmacy is a branch of the inpatient pharmacy that provides pharmacy services to a specific patient area like the operating rooms or the oncology pharmacy. Central pharmacy is the main inpatient pharmacy and provides most of the hospital pharmacy services. The role of the technician can be quite different in a hospital pharmacy, but some areas are very similar to retail pharmacy. Technicians man the front counter, meaning fielding phone calls about missing medications and troubleshooting Omnicells on the floors. They also prepare medications to be sent to the floor. Technicians also prepare cart fill, which contains a 24-hour supply of medications for specific patients. Some hospitals allow technicians to enter orders. At MSHA, this is the pharmacist's responsibility. The text mentioned that technicians assist in monitoring drug therapy, but I'm not aware of this taking place at MSHA. Technicians do coordinate controlled substance distribution. Another big role is delivery of medication to the nursing units. Depending on the size of the facility, there may be a technician dedicated to automation systems that help with downtime procedures and troubleshooting dispensing cabinets on the floor. Some technicians are in charge for quality assurance, in which they ensure other areas of the hospital are handling medications in compliance with the hospital policy. For facilities conducting drug studies, technicians assist in the preparation and delivery of such drugs, as well as the documentation. There's compounding and unit dosing. They assist in staff development, which may include providing training material and demonstrations. Technicians are responsible for preparing IV medications in the IV room. The pharmacy buyers want to perform inventory control, and some staffing models have a pharmacy technician supervisor. Batching refers to the preparation of a large quantity of unit dose oral solutions or small volume IV medications for future use. In bigger facilities, several batches are prepared throughout the day to cut down on workload. The clean room is the space for preparing sterile products. The outpatient pharmacy is a pharmacy attached to the hospital that provides pharmacy services to patients leaving the hospital or any patient that needs a prescription filled, whether it be an employee or someone else. We won't go over this again, but this is a slide recapping some highlights of USP 797. In general, medications are organized based on route of administration. Oral tablets are located in one area, and intravenous in another, and so forth. The routes are then separated further, oral liquids or small versus large volume parenterals. Like most pharmacies, medications are placed in alphabetical order. The caveat is that it usually gets mixed between brand and generic names, so it's good to know the brand and generic names of each medication. To take organization a step further, medications are separated into refrigerated items and frozen items. Johnson City Medical Center stores controlled substances in a totally different area than the rest of the medications. We call it the NARC room, and we have dedicated technician to manage this area. Here are a couple of examples of refrigerated items. Epigen, used to stimulate the production of red blood cells, and Neupogen, used to stimulate the production of white blood cells. Here are some vaccines that are stored frozen: MMR and varicella combination, Varivax and Zostavax. Some antibiotics such as vancomycin and Zosyn are stored frozen, then thawed and kept in the refrigerator until needed for use. Some items are compounded in bulk. One example of this is Miracle Mouthwash, which contains nystatin, Benadryl, and hydrocortisone. When this is done, a compounding log is completed which may contain the ingredients along with the amount used, the manufacturer, lot number, and expiration dates. We have already reviewed the concept of formularies. As mentioned previously, unit dose contains the amount of drug required for one dose. This cuts down on medication errors. The first hospital I volunteered in back in the day used medication carts, which was a cart that consisted of drawers for each patient. Each drawer was filled with daily medication for the particular patient and then sent to the floor. The text reviews the process of cart filling. It explains that oral medications are sent to the nursing unit in medication carts containing 24-hour dosages for each patient on the unit. At Johnson City Medical Center, we send up the cart filled individual bags for the patient. The bag is then sent to the nursing unit and placed in the patient's drawer or in a central cabinet where it can be located by the nursing staff. I'm not too familiar with the use of robots to help with the cart filling process. Everything I see is pretty much done manually. We do have in the pharmacy 3 carousel machines where medications are stocked. Instead of a technician walking to a shelf and pulling the medication, the carousel is prompted electronically to rotate to the specific bin where the drug is located, so the technician can pull the medication. The cart fill is printed somewhere around 5 o'clock every day, and the carousel machine is automatically prompted to dispense the cart fill medications. No one has to enter the drugs individually into the carousel. Even though this may cut down on how much manual work is done in the cart fill process, you can imagine how much effort it probably takes to keep everything stocked in the carousel so you don't run into any issues. Have you ever used the tube stations at banks? They send you a tube, and then you place a deposit into it and you send the tube back to them. Imagine that, except you can't see the person receiving the tube. We have a system just like this at Johnson City Medical Center. In fact, we have an area that contains 4 pneumatic tube stations. This greatly speeds up the process of medications getting to the floor, but there are some limitations of this system. The system doesn't always work. Some medications like insulin may undergo degradation when sent through the tube station. Our tube station is limited to no more than 500 mLs at one time in a tube, so liter bags cannot be tubed to the floor. Narcotics are restricted because there's no way to keep accurate documentation of where the drug went. Sometimes you hit 7.4 to send the tube to 7400 nursing station. And because there's an issue with the route, it ends up on 6400. Medical records, also known as health records, provide a detailed description of a patient's medical history in chronological order. All this used to be done with paper charts, but now we have electronic medical records. Electronic records allow healthcare providers to access information that includes medical records, billing, and patient appointments from a secure location. Let's review some of the things we might see in a medical record. There's a demographics section, which you can find personal information about the patient, allergies, medical history including any diseases the patient may have, medication orders, which will show what orders have been written for the patient so far in the patient's visit. There's also a section for medication administration record. This is not used as often now because the record for administration is kept electronically. This comes into play when the computer systems are down and we have to run downtime procedures. You can print downtime MARs and the nurse can record the time the medication was given, along with his or her initials to show who administered the medication. There's a laboratory section. You can find information on the patient's white blood cells, potassium, serum creatinine, and sometimes they have the culture and sensitivities located in this section. If the chart does not have a separate radiology section, x-rays may be found here as well. Also, flow sheets are used to track vital signs or blood sugars on a scheduled basis. If a patient is on a PCA, then the nurse may keep a flow sheet to follow how much medication a patient is receiving every hour. One of the most helpful sections I use on a daily basis is progress notes. In this section, you will find notes by the physician, social worker, physical therapist, infectious disease physician, and pharmacy, just to name a few. This gives you a better understanding of the progress, assessment, and plan for the patient. If you work in a hospital, you will soon discover there are several different orders. Standing orders, also called schedule orders, are orders for patients to receive a particular medication at regularly scheduled intervals, such as every 8 hours. PRN orders are for patients who might need the medications only now and again. Sometimes the doctor will write an order for Dilaudid, 1 milligram IV every 2 hours as needed for pain score greater than 4. So this patient would only receive Dilaudid if their pain score was greater than 4. Stat orders are orders that are needed right away. A lot of patients in intensive care will be on IV drips that may be used to pretty much keep them alive, and so the orders for these medications are stat. Now we'll talk about how CPOE, or Computer Physician Order Entry, has changed the process of order entry. This is a bit modified from the slide, but the idea is pretty much the same. Before an order was written in the chart, the nurse would take the order and scan the order into what is called OmniLink, which allows the pharmacist to view the order scan, almost like an email. The medication is entered by the pharmacist into the pharmacy program. We use Siemens Pharmacy for our order entry. Now, some hospitals have technicians that enter the order, and then the pharmacist reviews and verifies the order after the nurse or after the technician enters it. The technician then fills the order and the product is checked by the pharmacist. The medication is then either delivered by the technician or to the appropriate nursing unit. Now with CPOE, the physician or designated agent of the physician enters the order into Sorian. Once the order is signed into Sorian, it comes across the Siemens pharmacy and the pharmacist reviews the medication and validates the order. Once the nurse verifies the order, the medication can then be pulled by the nurse in the Omnicell cabinet on the floor. The Omnicells are set up to send stockout reports once medications fall below a certain PAR level. Through this course, we keep touching on the concept of inventory management. You've probably already concluded this is a very important part of a technician's job. As reimbursements from insurance companies trend downward and budget cuts are made, inventory control becomes a more vital role. Even though the automation of inventory allows for more accurate and less costly management, inventory needs to be reviewed and any discrepancies need to be resolved. The PAR level is the level of drug product you want to keep in the pharmacy. Drugs used daily will have a higher PAR level than drugs used just occasionally. A drug recall is the removal of a drug by the manufacturer, either voluntary or involuntary. This typically pertains to a particular shipment or lot number. The text talks about REMS, which stands for Risk Evaluation and Mitigation Strategy. The FDA requires manufacturers of drugs with safety concerns to complete one of these. Manufacturers may do one or more of the following. They can provide a medication guide or patient package insert, develop a communication plan for healthcare providers, create an element of assure safe use, and/or develop an implementation plan. The element to assure safe use may require prescribers to complete specific training and certification, only allow the drug to be dispensed in certain healthcare settings, require specific monitoring for patients, and/or require patients to register for use. Some drugs that require REMS include Tracleer, Aranesp, and Ticasol. If a patient is unable to eat or has a non-functional GI tract, then he or she may be a candidate for TPN, which stands for Total Parenteral Nutrition. These mixtures contain proteins and carbohydrates to provide calories to the patient, as well as essential nutrients to be given intravenously. There are three main sources of calories for patients: proteins, carbohydrates, and fats. If fats are in the TPN, then it's called a 3-in-1. If fats are given separately, which is the case at JCMC, the TPN is a 2-in-1. An epidural is another product you will find yourself making as a technician. Since this product is being infused into the patient's epidural space, the product has to be sterile, preservative-free, and it cannot contain any air bubbles. Some IV medications expire within a few hours of making them, so we say they have a short stability. We usually wait until the time they are due in order to make these medications, so we don't waste the product if the nurse is not ready to give the medication. We mispronounce this acronym as JCAHO, but this actually stands for the Joint Commission on Accreditation of Healthcare Organization. The text refers to this as TJC, or the Joint Commission. The organization surveys and accredits facilities every 24 to 39 months. Even though this is not a requirement for hospitals to provide care, CMS and other insurance providers require accreditation for reimbursement. CMS surveys and provides approval for facilities to provide care to Medicare and Medicaid patients. Their approval is required for reimbursement. The state boards of pharmacy regulate the registration of pharmacists and technicians, but do not directly govern hospital pharmacy departments. The USP develops standards to assure the quality of medications and related products that are available to the public. The DEA is responsible for enforcing controlled substance laws and ensuring facilities are following them. All patient care areas are required to have code carts, which are also called crash carts in case of emergencies. The carts contain medications that may be needed if a patient has a code blue or rapid response called on them. Each cart has a plastic lock that can be broken when the medication tray is needed. It is the pharmacy's responsibility to maintain these trays. We have already reviewed universal precautions, but something we may not have talked about yet is the sharps container. Needles or other items that might puncture the skin should be thrown away in the designated sharps container.